Hey y'all, and welcome back to my page. On this page, I talk about technology, money, health, wellness, and any other topics that I find interesting or that you all send me articles on. If this is your first time here, please consider subscribing to my page. And if you find the information in this video helpful, like the video and also share it with your friends. Thank you. So today I'm talking about nursing informatics, but specifically I'm talking to bedside nurses. And bedside nurses, I'm going to give you 3 reasons why your voice matters and health IT matters. I'm all for encouraging bedside nurses, not just bedside nurses, but nurses in all specialties to consider how their voice is important when it comes to matters related to healthcare IT. But specifically today, I'm talking to the bedside nurses. I've been an informatics nurse for 18 years, and I have seen a lot of change as an informatics nurse in those 18 years. Before that, I was a bedside nurse for 5 years, and even in those 5 years and then over the last 18 years, I can see how healthcare IT just continues to evolve. It continues to change. Healthcare IT is becoming more automated. It's also becoming more integrated with integration between multiple systems, and it's also becoming more digital, not only for bedside nurses and the work that they do, but for our patients, for our payers, etc. And I'm even thinking about now when I first started as a bedside nurse, when we were still doing manual documentation, and the flow sheets were literally they used to be, when you unfolded them, they would be like about this wide and about this tall. And if you floated to the ICU, the flow sheets were like super long. I sound like my parents when they talk about how school used to be. But the point is how healthcare and the IT infrastructure, technology, etc., it's just going to continue to evolve. And it's really important that bedside nurses, you understand how important that your voice is. And so I'm going to give you 3 reasons why your voice really matters when it comes to healthcare IT or healthcare information technology. Number 1, your proximity to patients is paramount. You are literally at the core, you're at the hub, you're at the source of patient care. And this is so valuable because bedside nurses, you all see firsthand how changes in the outside world, how those changes impact the community, and what brings patients into the healthcare system to seek care, to need care, etc. So just your proximity to patients and where you are positioned as a bedside nurse, that's very valuable. And I'll get into more in my next 2. So number 2, related to number 1, bedside nurses, you know and you understand workflows. You understand the workflows related to direct patient care, and beyond just the technical workflows, like when you're doing your patient care and you're documenting or you're working in like clinical software, but you also understand non-technical workflows. So when I say non-technical workflows, I'm talking about in those situations where maybe the clinical system has unexpected or an expected downtime, you still have to know how to deliver that care without the technical systems. The patients still need to be taken care of. So bedside nurses, you have that duality of understanding technical workflows when it comes to taking care of patients, and you understand the non-technical workflows. And you know, as a bedside nurse, if you're used to documenting in clinical systems, working in clinical systems, you know right off the bat if a system design or a system upgrade does not work. And when I say do not work, I'm talking about all aspects of clinical software. Bedside nurses, you know if a change or upgrade to like a flow sheet or a medication sheet or wound care documentation or TPN documentation. You know if system changes and upgrades do not work, and you know if a system design is not logical or optimal for nursing documentation, and also the data that is captured with the work that you do. All right, so the last reason and the third is you are often, bedside nurses, you are often the voice of the patient beyond the clinical software that you use for patient care. So what do I mean by that? Patients give you feedback on their experience in navigating through the healthcare system beyond just what brought them into the hospital, from fulfilling medications, automated system, through scheduling appointments, automated a system to communicating with their providers, either in the hospital or outside of the hospital, that communication piece. And that the information that patients share with you has value, especially if it's captured and delivered to the right people who can make lasting, useful changes. So the point here I'm making is bedside nurses, is not to underestimate the value that your voice brings to healthcare. You're valuable, and hopefully you have the opportunities to voice your concerns as it related to healthcare IT, clinical software, clinical system design, whether that's through hospital committees, whether that's through nursing organizations at the local, regional, state, and national levels, or even voicing that feedback, your concerns, etc., your input to healthcare leadership is very valuable. And I want you all to understand how much weight that carries. So that's it. I just wanted to give three reasons why bedside nurses, your voices are important to healthcare IT matters. And this list is not all inclusive. So I love to hear from you guys. I love when you message me, ask questions, give feedback. So what are your thoughts on this? How do you think bedside nurses contribute to and impact healthcare IT beyond the value that they provide to bedside patient care? So I'd love to hear from you guys. You can leave a comment below. You can message me. Consider subscribing to this channel. And if you find this information helpful, like the video and share it with your friends. Thank you, and I'll see you in the next video.